There have actually been a couple of very interesting studies that were just published. The authors were Rothwell and colleagues, and this was a group out of the UK. The first was very interesting in that there was 51 randomized controlled studies that they analyzed and looked at, and they were looking at the effect of low-dose daily aspirin on the prevention or reduction in risk of colorectal cancer occurrence. And what they found was very significant. They found a 38% reduction in the risk of developing colorectal cancer with the use of low-dose daily aspirin. We're talking about an 80 milligram dose. That would be essentially what we're talking about. They also found that it decreased the risk of colorectal cancer metastases. So this is very interesting and good news for patients that might develop colorectal cancer, because remember, colorectal cancer is a very common cancer and still the third most commonly occurring cancer in men and women. This data is very interesting, but we can't say that everyone can take a daily low-dose aspirin. Even though we're talking about a low milligram amount, that 80 milligrams, there are still risks associated with taking daily aspirin. So this is something that an individual patient would need to talk about with their physician to determine if it was appropriate for them. The risks are, of course, bleeding, and you can have gastrointestinal bleeding, CNS bleeding. So it's not insignificant. So therefore, this is something that you need to discuss with your primary care physician before you undertake it. An additional study that was published, and these were actually published in Lancet and Lancet Oncology with the same group of authors, also looked at the effect of low-dose daily aspirin. They were looking at observational studies versus controlled trials. And what they found in the cohort of patients that they were examining is there was actually a very significant reduction in the risk of developing esophageal cancer. In fact, it was 75%. And it also they noticed that it reduced the risk of developing colorectal cancer by 40 to 50%. So that corroborates the results of the first study that I was talking about. So this information is very exciting for us because, again, very common tumor type that we would really like to make an impact in the reduction of patients developing this disease.